Okay, our next speaker, he's actually the chairman of Medical Subdivision of Malaysian Invention and Design Society. He has authored numbers of clinical papers, including the chapter in International Medical Textbook. He is invited speaker for multiple local and international prestigious medical conferences. To date, he has invented multiple Class 1 medical devices, and he has been won the multiple local and international prestigious awards. Today, he is going to share with us the conservative bowel solution for elderly. So, ladies and gentlemen, all my friends here, let us welcome Associate Professor Dr. Chu Heng Hai. So, Professor, are you ready?
Thank you. Thank you. I'm ready. Yeah. Thank you for introduction. Thank you for inviting me for this event. So in the past few days, we were talking about aging, and there's many issues that brought out make us worry about how are we ready? Can we cope? And one of the big issues that's brought up by Govin Teo yesterday was high medical inflation. So that is because our expenditure on medicals it keep increasing, and the main factor is actually population. Our population is getting older and older. This increase the demand. When demand increase, it's we try to cope with that by having financial planning. When we do financial planning, our hope is to increase our ability of buying power. When the buying power increase, what will happen? The price of the service of the goods is going to increase also. I think by this alone, we are not going to solve our problem. So the cost is going to go higher and higher. I don't see a reason that we can cope with just few approach. So we have to be holistic in handling this issue. And so because of this demand increase and what we see now, we know the medical field is recession-proof business. So that is not a good sign. It may be a good sign for those who are in this business, but it's a bad sign for us. We are not going to more of us going to be able to not going to be able to cope this financial the burden increase, high medical inflation. So here I'm going to share with you my view. So I'm going to start with the big picture, and then I'll go down in detail related to my research in bowel health, in the conservative approach to our bowel problem. So to start with, modern medicine to start with, things are quite simple. We have few basic, very important principles that we follow. First, do no harm. But in reality, we know that reports show that iatrogenic cause of death is number 3 cause of death in America. Iatrogenic means the cause of death due to medical treatment, due to medical error, due to medication, due to surgery. This is number 3 cause of death. That is opposite to what we want. The second principle is prevention is better than cure. If you look at that, the cause of death, 71% of the death globally is due to NCD, non-communicable disease. This is all preventable with basic, simple knowledge that we all know. Exercise, diet, all those things. But we are not doing sufficient enough in prevention, but we are talking about advanced technology in more and more invasive surgery or intervention. The third principle is conservative first, invasive last. Are we doing that? So technology advanced with more and more invasive things typically. Then if you look at doctors, when we climb up with our professional career, we learn more and more invasive things, and our salary also keep increasing, and our influence in the health system is also increasing. As a specialist, I say something, people listen to me. When I'm the treatment at the physio level, nobody's going to listen to me. So I'm going to share my experience in bowel health. So we have to understand, it's not that this concept alone. I share with you how I said that we have to do something to reduce the cost of health facility. I mean the health service. The health, as we all know, with the few days discussion, we know our main expenditure after we retire is actually medical cost. So we have to reduce that cost. Then only those elderly retirement would like to dare to enjoy the good environment, good facility like what has been proposed by Habibullah. So without that, we are very worried. We worry that we may not be able to cope. So here I'm going to show to you. I think you can see, right? Okay. First is stroke. Stroke is #1 disability in the world. Heart attack is #1 cause of sudden death. Colorectal cancer is #1 cancer killer for men, practically in every developed country in the world. Hemorrhoid, anal fissure is so common problem that it's associated with constipation. It's so common. Urinary incontinence, uterus prolapse, it is so common among elderly women. More than half of the women above 50 years old will have some sort of pelvic floor disorder, urinary incontinence. So they are so common among all of us, all of us when we go old. To treat this, there are a lot of advanced technology. The more advanced the technology is, typically, it is more expensive. To treat all this, we need a lot of specialists and subspecialists. The cost to treat that, it may cost us the whole life saving. So maybe before we die, we already exhausted our saving because of the high cost. So after treating with so expensive and so long, so many years, just like what one of our speakers yesterday said, the situation is going to be same and some even get worsened. Like one example here, urinary incontinence. Today, the world is facing the world's largest surgical complication in history, where affecting millions of women and 100,000 court cases in America alone. 100,000 court cases in America alone. And the number is keep increasing. The surgery is already been banned. And millions of women are suffering from that. So this is the outcome. So why the problem become like that? Because if you observe, we are actually treating the manifestation. We do not treat the root cause of the problem. So these are the diverse problems. If you talk about root cause, it is complicated or not? Let us see how simplified that we can go.
Professor Chiu?
Yeah.
Yeah, we have 3 more minutes.
I may need a little bit more, okay?
Okay.
All right, thank you. So the root cause is, if you look here, the stroke. More studies show 1/3 of the hemorrhagic stroke happen in toilet. Heart attack, a lot of heart attack happen in toilet. Colorectal cancer is associated with constipation. Hemorrhoid anal fissure is main complication of constipation. Urinary incontinence and pelvic floor prolapse is because of weakening of pelvic floor, because of prolonged repeated straining because of constipation. So to treat constipation, let us start with simple thing. The cause is habit influence. So we have to train our habit. We know lack of water and lack of fiber. That's why we just increase water intake and vegetable intake. That will help us. Lack of physical activity is one of the factors that we can do without any medication by increase our activity. The other thing is drug, medication, everything. There are multiple drugs for high blood pressure. Certain drugs may cause constipation. So we can discuss with the doctor to change that. So talking about so complicated thing, but it can be very simple. Study has shown more than 50% or more than 75% of pelvic floor constipation is actually due to weakening of pelvic floor, especially the posterior aspect. Because of this, the padding or the passage make us strain. When you strain, it damages the pelvic floor. It leads to a vicious cycle. Straining, descent of pelvic floor, and constipation. This vicious cycle, if you don't discontinue, it continues to worsen the situation. Even though we have hemorrhoid treatment, hemorrhoid surgery, it keeps coming back. So how to treat? How to manage this? Very simple. So you know, this descent has caused problem. So by having support over here, we have conducted study, multiple study has proven it is very effective. This study is not only in study, today it's already in 3 surgical textbook and also guideline. Simple. The solution is just support over here. You can even do with your own hand when you pass motion. That will treat. It's not what I say, it's not only what our past study said. In one of the studies done in America, they found that 96% of those with pelvic floor with constipation improve with just support alone. Manual support. We are talking about walking aid, hearing aid. Now we are talking about bowel aid, just to assist your bowel movement. So the solution is now, actually we have to bring down the cost. So through what? Through innovation. Innovation need not be more and more complicated. There are simplified version of this. So we can go back to our main principle. First, do no harm. Second, prevention is better than cure. Conservative first, invasive last. And the other thing is more important is it has to be affordable. Otherwise, no point. We can achieve science in advancement in science, but it's not affordable. It has to be scalable to cope for the increasing aging population. So with that, I would like to thank you.